It's my great pleasure to introduce this session of the BSE conference. My name is Tom Ingram. I'm a consultant cardiologist. We're going to spend a bit of time now talking about echo research and practice. And I'm really delighted to have with me today the two co-editors-in-chief. There's Petros Nihoyannopoulos, who is the co-editor-in-chief, and there's Mark Monaghan, who is the Deputy Co-Editor-in-Chief of Echo Research and Practice. And these gentlemen both have a long and distinguished career in echo behind them, and I think they need very little introduction otherwise. And I would really like Petros to start with you, if I may, and good afternoon to you, Petros.
Good afternoon.
Afternoon. Now, Petros, you've been involved with echo research and practice since its inception, which we were just trying to calculate, and we think it's just over 7 years ago. And I wonder if you could just spend a bit of time telling us all about the ethos behind the journal and your experiences over that time.
Thank you, Tom, and hello, Mark. Well, the first ERP was launched in, I believe, February 2014. And this was at a time where there were a lot of echo journals becoming imaging journals. And we believed as echocardiographers that echocardiography is more than just an imaging modality. It is a clinical day-to-day tool. So it does require its own identity and journal. As you probably know, I was involved with the launch of the European Journal of Echocardiography when I was then president of the ESEVI, or
ESE.
And we put as editor-in-chief Joost Roland, who was also a devoted echocardiography, a very good clinician, a very good professor of cardiology in Rotterdam, but a devoted echocardiographer at his late stage. So he was delighted to launch the European Journal of Echocardiography amongst all the hype of imaging modalities. And we took a distinct line to emphasize the need to publish and to educate young cardiologists echocardiography, a pivotal tool in clinical daily practice. So when the European Journal of Echocardiography was transformed to Imaging Journal, we discussed with Mark and the BSE presidents at the time the need for the British Society of Echocardiography to stand firm and promote echocardiography within the United Kingdom, but also worldwide, as perhaps the one other echo-dedicated journal to face the American Journal of Echocardiography, the AGE, which was, despite the other American journals of imaging, maintained the status and the identity of American Journal of Echocardiography. So as partners, we decided in the BSE to launch a new journal of for the British Society of Echocardiography, and that was Echo Research and Practice. In fact, the name was much debated at the time with Guy Lloyd, Rich Steeds, and Mark, and we came across the three words, echocardiography, of course, to emphasize the importance of the modality, the technique, but also research, which is important to publish, to promote research within the United Kingdom and beyond, but also practice, because practice is a clinical practice. We cannot imagine cardiology today without the clinical tool of echocardiography. We can, however, imagine cardiology without a stethoscope, but we cannot imagine cardiology practice without echocardiography in its multiple modalities. In fact, what was mentioning all along is echocardiography. It is an imaging modality on its own right. It has transthoracic, well, a mode for some, transthoracic, two-dimensional, three-dimensional, deformation imaging, transophageal, stress, and beyond. Contrast, of course, we cannot stop so many modalities that cannot be put under one umbrella of imaging. Imaging, leave it for the radiologist. It's okay, MRI, fantastic, CT, fantastic, but echocardiography is for the clinician. It is a clinical tool. And this is the need, that became the need for the creation of the British Society journal, Echo Research and Practice.
I have to say, Petros, you were reminding me there, talking about clinical practice and echo, of how much I personally feel I've benefited over the years from the manuscripts which the BSE has put out, the guidelines which we've put out, which has always had such a clear clinical focus, searching the wood from the trees, if you like. And I'm sure, you know, it's one of the great legacies of echo research and practice that we've been able to share that information, not just across the United Kingdom, but abroad as well, through a well-established medium of a peer-reviewed journal. Now, looking forwards, we've had some exciting changes with echo research and practice, and we have, as the British Society of Echocardiography, moved our publishing house, and we've moved under the arm of Springer Publishing. And for those of you who don't know, that we are in great company with the likes of Scientific American and Nature and other magnificent journals. And Petros, I wonder if you could just give me, you've been involved very closely with this change in publishing house, and I wonder if you could just talk me through your kind of excitement that we have now going forward with this new deal and what it's going to mean for the journal.
Absolutely. Well, Tom, the failure, so to speak, with our previous publishers was to acquire an impact factor. Yes, we understand as academics that an impact factor is important for cardiologists and other scientists to publish, because they want this magic number of impact factor of 10 and beyond. But, you know, how many papers can you publish in impact factor, high impact factors? So impact factor, yes, it is important, but not the only thing that a journal needs. And I remember very well Jos Roland telling us that, yes, every academic, every institution wants to publish on high impact factor journals. Yes, but the other part of the journal, the other needs for the cardiologist and scientist is to educate. And education does not come as an impact factor. So we need to serve our purpose both for the academic side, which is the impact factor, but also education. And I believe the British Society of Echocardiography is very strong in education, Europe-wise, probably one of the few societies, well-organized societies worldwide with such an emphasis on education. And I can see that ERP can be a vehicle to educate young cardiologists and young scientists. The British Society of Echocardiography is unique worldwide because it's not just a doctors' society. It is doctors, but also physiologists, scientists, and does not matter what is your background. What means, what is needed is to educate echocardiographers for echocardiography. Doesn't matter whether you are white, yellow, black, orange, cardiologist, anesthetist, physiologist, does not matter. All it matters is the education. What is your education? So, and this is why we need a good journal that will promote education and also to satisfy the cardiologists, you and I and Mark, so that we can publish in an impact factor journal. So the previous publishers did not manage to get us through this problem of acquiring an impact factor. So the new publishers, with the name they carry and the weight they carry worldwide, I believe strongly that they will help us get an impact factor. So not only education, yes, but also getting an impact factor, and that Springer will deliver.
That's very clear, Petros, and I think that's a fantastic aim we've got. And just drawing in on the education side, one of the main strengths we're going to continue with Echo Research and Practice is to have it as an open source journal. And even though we have yet to obtain an impact factor, when you look at our previous publishing house showing us how many downloads we had of some of the articles, and they were in the tens of thousands, if not beyond. So I think we really had our mission there to disseminate best practice as widely as possible. Now, Petros, sorry, did you want to finish, Petros, there?
Well, just to emphasize what you just said, that the papers that count a lot for an impact factor is the research, good research papers, of course, but also position papers of the society, consensus documents that are highly valued for acquiring an impact factor, and original research, which is obviously something that we need to get across the United Kingdom and Europe.
Fantastic. Yes. Petros, thank you very much. I'm just going to move our attention in the conversation now to Mark Monaghan. Good afternoon, Mark.
Tom. Hi, Petros.
Hi. Now, Mark is the Deputy Co-Editor-in-Chief of Echo Research and Practice, and just segueing on from Petros's introduction there to the kind of articles we're going to be hoping to accept for our rebirth of Echo Research and Practice, I wonder if you could just explain to everyone at the moment why everyone, and in particular why our members, should consider submitting their work to Echo Research and Practice.
Well, thanks, Tom. First of all, the main reason I would say is this is your journal. This is owned by the BSE. It's there for the BSE members and, of course, the wider readership as well, but it is the BSE journal. And therefore, I would like to think that as BSE members, we would put ERP right at the top of the list of journals that we're thinking of submitting to, because it will be widely read, as you've already mentioned. You know, articles that are published in Echo Research and Practice get widely downloaded. And I think the other reason is that, you know, Petros and I and the rest of the team at the BSE have worked really hard over the past few months as we've been going through this transition phase to make sure that we are going to deliver a journal that people will want to submit to. So first of all, it will carry high quality articles, but we also are going to deliver very short turnaround times. So, you know, we aim to be able to give you an answer as to whether it's going to be accepted or require revision within 20 days of submission. And we've got, you know, a completely renewed editorial board. We've carried forward those members of the previous editorial board that had a lot of experience and worked very, very hard, but we've also enlisted a lot more members, particularly junior members, who are going to be enthusiastic and help us achieve that rapid turnaround in terms of reviews. So, you know, that for a lot of people writing articles, I think is very, very important. You want a quick decision. And the other thing is that through the generosity of the BSE, we're hoping to support BSE members in terms of the charges, the APCs as they're called, for actually submitting to an open access journal. So there will be a very generous grant program available that will mean that the majority of BSE members will actually not have to incur any charges for submitting it to. Now we're keen to have, as Petros said, original articles, research, the recommendations and guideline documents. We will also publish case reports, but they don't really help the impact factor, so they will achieve a lower priority, and I'm afraid they will not be supported in terms of APCs.
No, it sounds like a really wonderful opportunity for members to expand their portfolio, work towards their STP accreditation equivalency. And I think the BSE grants are going to be very well received. Now, Mark, I wonder if you could just tell us when we're planning to open for submissions and when you think the journal will be back on our virtual bookshelves again, if you like.
Well, from now on, I mean, from the annual general meeting is the launch of the journal. The website is or should be available. And so people can start submitting. Our first publication will be in January of next year. So there's going to be a little bit of a hiatus, but of course, we're essentially starting from afresh. So we don't have a huge backlog of publications. So having said that, all the previous publications and the previous editions of ERP will be available on the new website. So all that work isn't lost. But we will publish the first episode of the journal in January, but we're open for submissions from now onwards.
Fantastic. Well, Mark, Petros, thank you so much for taking the time to talk to me this afternoon. And I am just really excited to take this project through to our members. And I'm so looking forward to seeing how it works out over the next few months and years.
We are very excited too, Tom.
Okay.
Yeah, absolutely.
Thank you.